consistency in access, consistency in methods, consistency in services and benefits, so that even if family one day is with Molina, they leave town, they go to the western side of the state, and maybe that's priority health, they know that those services and those benefits will be pretty consistent. So that's a very huge and significant recommendation. So, and others, does that capture what you were suggesting, one piece of it?
I would go beyond the Medicaid to include private as well as the publicly funded health insurance, frankly. But I'd settle for Medicaid, that would be fine too.
Okay, good. Other recommendations that we can make, policy-wise, to legislators and others?
Well, one of the issues that I think comes up related to access, Rosalva used the words having everything be a point of entry. And so if there were some key questions that were asked, whether you walked through the behavioral health care system or the medical health care system or DHS or schools, you know, I just would be curious to think about, like, what are the top 5 questions that we need to ask? Because we've all got our top 100 that our agencies are requiring that we ask. But what are the few things that we need to know that would indicate, okay, I should help this person access this over here? Because I know as in community mental health, one of the reasons we don't do that is just because we have so many other things. We can't even think about it. So if we had some kind of common set of assessment questions that would lead to a common set of coordination pieces, I think that would be helpful.
That's really significant, because that in fact is, if we begin to think, particularly if we think about certain populations of families, so if we think about the whole issue of infant mortality, for example, the fact that if it doesn't matter where a mom comes in or a childbearing woman, if we ask a couple of questions, have you ever experienced a loss? Have you ever had a premature? Those kind of basic questions, and no matter where we are, whether it's a youth group, a Girl Scout group, if we ask those questions, then we can provide a set of resources to that family, even if that's not what we do. So it's beginning to think more holistically that there are certain persistent and pervasive health issues that if we keep doing the same thing, we keep getting the same result. And certainly that's the case with certain mental health pieces. A couple more recommendations. Vicki.
One thing I was thinking about, the first scenario with the mother and the daughter that was had asthma, and the recommendation to see a mental health counselor. She walked away saying that we're not crazy. I'm not crazy. So who's going to follow up to see that she got what she needed, transportation-wise, phone call? You know, did you call a mental health place or some kind of follow-up within to see that she got what she needed? Because there's some serious issues there. She's saying she's not crazy. The doctor, when she came in, turned her back completely on that kid. Didn't even talk to that kid. She talked to the mom and just turned her back to her. So there's some things going on. There needs to be some additional follow-up from a social worker or someone to see that she received the service that she needed.
So just to kind of paraphrase, as families present with certain kind of issues and concerns, so that automatically becomes a trigger that literally mandates certain types of follow-ups. I mean, because we know that, right? There are certain things that become an indicator, and then there should be a follow-up versus us saying, oh, wasn't that something? But there was nothing that then triggered or required someone per their program design, or even for that matter, their performance appraisal, that they follow up with something specific. So follow-up, by the way, is one of those huge areas in human services. You know, we have a great deal of improvement to do. Jeanette?
Jametta, I was just wondering if we were going to meet with Congressman Hanson Clark, what would be one of like the key, questions or issue that we want to present to him as a takeaway so that he could advocate for us on behalf of that, in which we are going to meet with him next Monday, and we would do it for you, but we could only probably take one key issue.
Mm-hmm. Let's hear I know what Jametta's is, but let's hear from the rest of the audience right here. Let's get a couple.
Well, I'm probably biased.
Thank you for the question.
One of the key resources that we don't have in Michigan is in terms of school nurses. And a school nurse has a holistic picture of the child and the family and knows the community and knows the resources. I think if we had more school nurses in place, or district health coordinators, that you would not only see better health outcomes, but you'd also see better educational outcomes for the school districts. But that costs money.
Well, in fact, and you can ask why this is so, but Michigan is 50th out of 50 states in the ratio of nurses to students in the schools. We're dead last.
Cutting them up.
Yeah.
They kept cutting the physicians back.
Exactly.
Cut those out.
And
Right.
we're
So
expecting
if-
the education system to pick that up. You know, there's a lack of coordination.
And just to piggyback up on that really quick, and thank you for making that point, school-based health centers are an important vehicle for touching children, yet we also know in most cases they don't actually, all of them, many of them don't meet what's called the definition of a medical home. So what we're looking forward to with WCHAP is having conversations with Shami and many other school-based health centers about how do we connect those schools with those primary care providers so that we can particularly partner with the nurses, partner with those staff, but at the same time make sure they're getting that medical information, and then also to try to address some of the systems issues, because it's scary. Here's a good one for everybody. A physician who works in a school-based health center may discover an issue and may need to make a referral, but they can't make the referral because that patient doesn't belong to them. Those children all come into that clinic in kind of what we can call an aggregate way. None of those children are specifically credentialed to that physician, so that physician can't in fact make a referral to that family. That's pretty mind-boggling. But those are some of the systems issues that we're learning in our partnership with providers. So we're really looking forward to, and thank you so much, about how do we strengthen that safety net of communication between school-based health centers and building up children's medical homes. Got a couple others. Thank you.
There's a difference between school-based health centers and school nurses, and they each function in different
That's
roles.
true.
So, yeah.
Yeah, you're right. And there's not enough of either one. Right.
Okay, I think in order for all systems to be able to work together to help families work with the systems, it has to be across the board competency, helping families to understand what the systems are talking about, meeting the families where they are. You have some come in who can't read. We can tell them whatever you want, but if they don't understand what it is that they are needed to do, it's still setting them up for failure.
So literacy, we know, is a huge issue.
Yes.
Making sure that our materials are responsive to literacy, but that we're also building health literacy.
Yes.
And we're building literacy in general.
Even if you have, like we have it where you have it in different languages, but language is a part of literacy, but when a person can't read.
Okay. Some more for sharing back with Senator Hanson Clark. Other points? Two.
I would like to see the access of, to use the computer, because you can go to the library to empower the parents, and the ones that cannot read, they can click on and hear the a little movie play or something to explain to them about how to navigate through the systems. That won't cost a lot. Someone can create the program that knows specifically, just summarize what is needed possibly, and they could click on and navigate through there. If you don't have one, you have a phone, you have a neighbor, you can reach out that way, and that won't cost a lot of money, and we can empower each other that way.
Yeah, we can be a little bit creative with that. If we can tweak anything else, we can certainly come up with ways for that. Jason?
One thing that you touched on a little bit earlier, Jametta, is the fact that sometimes physicians will prescribe psychotropic medication when there's no psych eval. I think that definitely needs to be highlighted. It needs to be brought to everyone's attention. I can't even tell you how many cases I've reviewed and looked at or have been involved in some way, shape, or form where the actual physician has prescribed psychotropic medication because of what the foster parent has said or what the bio parent has said or how the child is actually behaving during that appointment. There's been no evaluation, no assessment, and the medication has been prescribed. And sometimes, most times, it's a misdiagnosis, and the medication that's being prescribed is not even the appropriate milligrams most times. So we need better communication between the actual physicians and the psychiatrists and psychologists.
We're aware that we need to get ready to wrap up, and I hope that you're finding this a rich conversation. There are a couple things as we move forward. You know, why did we even come together to do this? One, we wanted you to know that integrated health care is essential. It's not even a question. The question becomes, as Carlin said, is coming up with those specific models and approaches. And that's what we are working on. And if any of you are interested in that, particularly, we're really pleased to look out and see so many students. Will all the students raise their hand? This is really great to see students because we're about changing our mindset. So you're part of that future. We want you to know that we are also putting together recommendations around policy, funding, and best practices. Here's things that you can do. One, Tony Harkey, raise your hand back there. You've been quiet. Great Start. Tony Harkey is our project director for Great Start Collaborative Wayne. Parents, get involved with your Great Start Coalition. That is a place to begin to learn and advocate. We need everyone, by the way, to talk up prevention. Chronic disease are the result of us not having spent enough time in prevention. Actually, and we have to be willing to test ourselves, evaluate ourselves, come up with meaningful results to show that prevention can help reduce the cost for acute care, whether it's hospitalization in a mental health facility or whether it's hospitalization on the physical health side. If you look down that one or two of those very last ones, we want to let you know that we're going to be taking what we've discussed today. And in fact, our PHW, I'm the acronym queen, don't want to say the whole thing. The Pediatric Integrated Healthcare Work Group meets this Friday. We're going to look at what did we learn today? What did you share with us? And see how we build this into our work plan. We have 3 work groups. We have the Advocacy and Awareness Work Group that put this event on today. Thank you very much. And we specifically had our simulation team, which are the WCHAP players. And I particularly want to thank Roberta and Jennifer, who have been so instrumental, not only for our PHW in general, but specifically around the simulation. So there's some things that you can expect to do. We want to let you know, please advocate for integrated health care. We want you to learn more what it means when we say that every child deserves a medical home, which is not a house, but it's a place where people know you, that have information, that are responsive to you, that coordinate, that provide a continuity of care, and it's family-centered. It's not just the child, but a willingness to assess and make meaningful connections and be engaged in an ongoing manner. And that's the very work that we're about. Lastly, I want to let you know that you should know that there are early learning hubs in your community. Those are places to build literacy. And of course, if you look at number 9, you can always pick on Carlin. And one of the many mental health agencies that are there, while many of them may be required only to provide acute care, these are specialists that care deeply about children. So they are available to talk to you about infant mental health. They're available to talk to you about early intervention programs too, because it's not always responding to the acute problem or the chronic disease. It's how do we get involved very early, and we want you to do the same thing when it comes to both your physicians and nurses. And so with that, I suppose we want to thank you so much for attending our very first Advocacy and Awareness. And I would ask, before we leave again, I'd like for each one of the WCHAP staff to come on out and let's